Welcome to course 103 Rural Society and Polity in India, Unit 4 on the fundamentals of rural demography and economy. This unit will be covered in 4 lessons in the following manner. First, rural demography, understanding rural population, its size, gender, literacy, age, birth rate, mortality rate, etc. Second, rural economy, the nature, scope and its importance. Third, rural labor force. What is rural labor force like? What is the participation of women in labor force? And fourth, understanding rural poverty. The issue of migration will also be discussed in Unit 4. The current lesson is lesson 1, that is rural demography. The objective is to understand the characteristics and composition of rural population. The lesson is structured in the following manner. First, the basics of demography. We try and understand and define certain terms. An overview of rural settlements as per population. Then we will look at some overall figures, total population, what is the growth rate of population, what is rural urban distribution of population. We then move on to look at figures on sex ratio, literacy, male female literacy and distribution of population as per age. We will then cover birth rate, also fertility rate and mortality rate. Let us begin and familiarize ourselves with some basic terms. Demography. Demography is the study of human population using statistical tools and methods. It's actually derived from 2 Greek words, demos meaning people and graphy refers to science. So, therefore, the science or study of people. It is the study of the size, territorial distribution, composition of population and the changes over time. In other words, it is population disaggregated or broken down across specific parameters like gender, age, health, literacy, etc. And this data is collected, analyzed and then presented. Such broken down or disaggregated data about population helps in planning interventions, different development and welfare programs. It helps formulate policy, it helps in program implementation, also in research and public debate and in general economic and administrative decisions that are to be undertaken for national development. Demographic data is large scale data that is collected and put together. Where is such information or data on population or demography available? There are different sources where it is available and the sources from where we can access this information are the Census of India, the sample registration system, the National Sample Survey and also the civil registrations. First, the Census of India. A census is an enumeration of each household. It's an account of each household. The census is the largest and most authentic source of data because information is collected from every member of the population, every household of the population and not from a sample or subset of that population. It provides information about age, gender, socio-economic characteristics of population. The Census of India was started in 1871, but the first complete census was in 1882 and since then the census has been undertaken in India every 10 years, every decade. The last census or the most recent census of India that was undertaken was in 2011, which was the 15th census of India. The census after that was to be undertaken in 2021 has been delayed. Sample registration system. The sample registration of births and deaths popularly is known as sample registration system. It is a demographic survey which provides reliable annual estimates of infant mortality rate, birth rate, death rate and other fertility and mortality indicators. It was initiated on a pilot basis in a few states in the 1960s and became fully operational in 1969-70. The sample registration is a continuous enumeration or counting of births and deaths in a sample of villages or urban blocks. Unlike the census, which is a complete enumeration or an enumeration of each household, the sample registration is based on a sample or a subset of the population. This is done by a resident part-time enumerator, and also an independent 6-monthly survey is done by a full-time supervisor. The data that is obtained from both these sources is matched in order to make it authentic and correct. The National Sample Survey provides data on various socio-economic subjects through nationwide sample surveys. A sample is selected from an entire population in order to make some inferences about that entire population. And the sample that is selected is in a manner that, to ensure that it is representative of the entire population. The National Sample Survey Office was set up in 1950 to conduct these large scale sample surveys throughout India, and recently in 2019 this was merged with the Central Statistics Office and put under the umbrella of the National Statistics Office. The schedule of surveys is a 10-year cycle, and across different subjects, this is undertaken twice or once. The civil registration system accounts for births and deaths that occur. There are registrars who have been appointed for each local area who register the births and deaths that occur within that area. Institutions like hospitals, health centers, nursing homes or even other institutions, they have the responsibility of informing a birth or death to the registrar. And also the public, in case of birth and death, a citizen should inform about the event to the registrar of their jurisdiction. Some other terms. Population size. Population size refers to the number of people living in a particular area at a given point in time. So, for example, India's population in the year 2011 is so and so. How people are physically dispersed across a geographical area is population distribution. For example, India has a total population which can be distributed state-wise or district-wise or further block-wise or further village-wise. Population density refers to the number of persons living per unit of an area, that is per square kilometer or per kilometer. For example, if we look at the map here, the states in India have been classified as per the population density, that is number of people who live per square kilometer. So, if you look at the range, you can have between 0 to 49 persons living in a square kilometer to more than 9,000 persons living in a square kilometer. So, if you look at the map, the state of Delhi has a high population density where it is more than 9,000 per square kilometer. Other states with high population density are the state of West Bengal and the state of Kerala, which report about 1,000 to 1,199 or between 1,000 and 2,000 persons per square kilometer. States with low density of population are in the northeast, for instance Arunachal Pradesh, which shows a population density of between 0 to 49 persons per square kilometer. Composition of population refers to characteristics of population such as age, gender, literacy, employment, marital status, etc. A change in population can be recorded through three broad components: births, deaths and migration. As far as rural settlements are concerned, in the census of 2011, Villages have been divided into 6 categories according to population size, the total population. The categories are less than 500, 500 to 1000, 1000 above to up to 2000, 2000 to 5000, 5000 to 10,000, 10,000 above. As of 2011, the maximum percentage of villages have a population of less than 500. So, about 32.9% of villages have less than 500 population. Although the percentage of villages in the smallest size is more, but if you have a look at the table, in terms of population, the highest percent, that is 34.6% of the rural population or persons live in villages that fall in the size of 2000 to 5000. This implies that more population is being concentrated in the relatively larger sized villages. Rural population in terms of total population, rural urban distribution and growth over the years. Let us have a look at some of these statistics. If we look at the total population of India, which is about 121 crores, of this 83 crores is rural and 37 crores is urban, which means 68%, more than 68% of total population is still rural. So, majority of India's population is still rural. This table depicts the growth in population over a period of 10 years. So, if you have a look, we have total population of India distributed across rural and urban in the year 2001 and also in the year 2011. So, rural population, which was at 74 crores in 2001, has grown to about 83 crores in 2011, a difference of 9 crores. In case of urban population also, there has been a growth of a little over 9 crores. This figure shows how rural population in India has fared from 1960 up to 2020. So, if we look at rural population in absolute terms, then we do note that there has been a steady growth. But the greater or let us say the growth has been more or steeper from 1960 till about 2000. Then the growth has been lesser, and 2010 or post 2011 the growth has been even lesser. It has been there, but not a very steep growth, rather gradual growth. This table corroborates what we just saw in the graph. In rural India from 91 to 2001 and 2001 to 2011, the growth rate of population has seen a decline. So, nearly a decrease of 5.9, close to 6. If we look at the percentage of total population of India, which is rural population, that is, if we look at rural population in relative terms, as what percent of total population of India is rural, this is what is depicted in this graph. So, from the time frame 1960 to 2020. As per the 2011 census, 68% of India's total population is rural. Now, if we look at 1960 as given in this graph, the percentage of rural population to total population in India was 82%. And then we see that this percent contribution has been going down. So, in 2020 it is about 65%. So, there has been a decline in the percent contribution of rural population to total population. So, now let us look at rural population in states in terms of the contribution of specific states, their rural population to the total rural population in the country. The states which contribute a considerable share to the total rural population of India are Uttar Pradesh, the share of which is 18%, Bihar, which contributes to about 11% of India's total rural population, and followed by West Bengal. The states of Sikkim, Mizoram and Goa do not contribute much to the total rural population in India. In order to understand the distribution of population in rural and urban areas, let us have a look at these images. So, what we see here is three different time frames: 1901, 1951 and 2011. So, in each of the images we see that the contribution of rural population to the total population is significant. However, this has been declining, and what I mean by this is, in 1901, 89% of the total population in India was rural. In 1951, 82% of the total population was rural, and 2011, 68% is rural. The urban population is steadily increasing. Although a majority of Indians still reside in villages, the rise in population residing in urban areas can be attributed to increasing urbanization and a rural to urban migration in search of better education and employment opportunities. We see that urban population has increased from 10% to 17% to nearly 31% in 2011. Sex ratio, number of females per 1000 males. If we look at the first table, we see sex ratio across two time frames, 2001 and 2011. In rural India, the sex ratio stood at 946 in 2001 and in 2011 at 947, that is 947 females per 1000 males. This is further broken up in the adjoining table, where the percentage composition of men and women in rural population is given across the same two time frames, 2001 and 2011. So, in 2001, 51.4% of rural population was male and 48.6% was female, and this has remained the case in 2011 as well. Moving on to the second set of tables, we see the sex ratio in the age group of 0 to 6 years. Here in rural India, in 2001, the sex ratio for 0 to 6 years was 934, and in 2011 at 919, which means there has been a decline. 919 females per 1000 males in the age group of 0 to 6 years. If this is broken up further to understand the percent, we see in the adjoining table that in 2001, 51.7% of rural population in the 0 to 6 years was male and 48.3% was female. In 2011, we see a change in this percentage, 52% being male and 47% being female. So, there has been a decline, a slight decline in the female population in the 0 to 6 years. Literacy rate, the percent of those literate in the total population. The first table shows rural, urban and India's total literacy rate, again across 2001 and 2011. In rural India in 2001, the literacy rate stood at 58.7% and 2011 at 68.9%. So, there has been an improvement of nearly about 10%. If this is broken up to understand male female literacy rate, what do we see? In rural areas in 2001, the male literacy rate stood at 70%, 70.7% and female at 46%. and in 2011 at 78.5% for males and for females at 58.7%. So there has been an improvement in the literacy rate for both males as well as females, and the growth has been more or better in the case of females. But still we see that there is a gap between male and female literacy rate of about 19%. This is what is depicted in this graph. Age group distribution. The percentage of distribution of population by age groups. What the table depicts is population across 3 age groups: 0 to 14 years, 15 to 59 and 60 plus years. So in rural India, we see that majority of the population falls within the age group of 15 to 59 years. So 61% of rural population is in that age group, followed by 30 to 31% in the age group of 0 to 14 years, and the least under the 60 plus age group. And this is the same trend that we see both in female as well as male population of rural India. The pie chart also depicts the same change in population. This can be seen across the components of births, deaths and migration, and in this lesson we will look at births and deaths in rural India. The birth rate. Birth rate is the total number of births in a year per 1,000 individuals or per 1,000 persons. I repeat, it is the total number of births in a year per 1,000 individuals or persons. It's a crucial determinant of population growth. India's birth rate has drastically declined over the last 4 decades, from 1971 when it was 36.9 to 20 in 2018. That is 20 births per 1,000 persons. Let us have a look at this figure. The figure depicts birth rate with the reference year of 2016. On the x-axis we have the states, that's the horizontal axis. We have the names of the states, and on the y-axis is the birth rate, that is the vertical axis. And we see that the bars are in 3 different colors. The blue depicts the total, the red depicts the rural, and the green depicts the urban. If you look at the first bar, which is total figures for India, the birth rate stands at 20.4. For rural areas, that is the red bar 22.1, and the green bar for urban areas is 17. Among the states, we see that the state of Bihar has the highest birth rate for rural areas, and Kerala has the lowest birth rate in rural areas. The fertility rate. Fertility rate is the number of live births in a year per 1,000 women in the reproductive age group of 15 to 49 years. So it is number of live births in a year per 1,000 women in the reproductive age group. The birth rate of a population is not age specific, but the fertility rate is age specific. It accounts for the fertility of women concerning different reproductive ages. In brief, the birth rate and fertility rate both are measurements of population growth. Before we move on to have a glimpse of fertility rate figures, let us have a quick look at age for marriage. So the graph here depicts mean age at effective marriage for females. At the national level, the mean age at effective marriage for female in the reference year of 2011 is 21.2 years. In rural areas, this is 20.7 years, and for urban 22.7 years. So, clearly in rural areas, the mean age is earlier for a female. Among the states, we see that this varies from 20.2 years in Chhattisgarh to 24.1 in Jammu and Kashmir. Fertility rate. The figure depicts fertility rate with the reference year of 2016. Once again, you see the x-axis gives the states and the y-axis actually gives the fertility rate, and you see the three different colored graphs. Blue is for total, red for rural, and green for urban. At the national level, 74.4 children were born to every 1,000 women in the reproductive age 15 to 49 years. In rural areas, this number was at 81.8. So, 81.8 children were born to every 1,000 women between 15 to 49 years, and in urban areas this figure is 59.5. On the basis of data on births to women by specific age groups in the reproductive span of 15 to 49 years, age specific fertility rates have been calculated in the given table, where the reproductive age of 15 to 49 years has been further divided into 7 categories. As we see in the table, fertility rate in all the age groups in all the different 7 categories is higher in rural areas than in urban areas, and highest in 25 to 29 years. Then in the age group of 20 to 24 years, and the same is corroborated in the adjoining figure. If we look at the figure, we see that the fertility reaches the peak in the age group 25 to 29 and declines thereafter, irrespective of the place of residence. So, both rural and urban curves that we see in the figure have declined very steeply after attaining the peak for the age of 25 to 29. This figure shows the fertility rate in rural India over a period of 10 years, 2004, 2006 and 2014 to 2016, and the changes there. So, once again on the x-axis you see the states, and on the y-axis you see the fertility rate. The bars in blue depict the year 2004 and 6, and those in red depict the reference year 2014 to 16. So, what we see is, we see a declining fertility rate trend from 2004-06 to 2014-16 in India, but also across all the states except in the state of Kerala. If we are to understand live births by medical attention that is received by the mother at delivery, this figure gives us a glimpse. The reference here is 2016, and it represents live births by medical attention in rural areas. So, we see that across all the states given on the x-axis, and the bars represent the type of medical attention that is received, and here we have the categories of government hospital, private hospital, qualified professional or untrained functionary and others. We see that most across states are availing government hospital facility, which is depicted in the blue colored bar, except in the state of Kerala, where both government and private medical attention has been received by mother at delivery. This graph shows the percent distribution of live births by birth order, which means whether it was the first, second, third, fourth birth. And here we see that once again across different states we see the same pattern, which is that mostly the live births have been the first birth or the first child to the mother. The parameters of mortality are seen in terms of death rate, infant mortality rate and maternal mortality rate. Death rate is the deaths calculated per 1000 of population. According to data in 2018, death rate in India stood at 6.2 and Chhattisgarh had the highest death rate at 8 while Delhi had the lowest at 3.3, also indicating better healthcare facilities. The given tables depict the death rate by gender and across rural and urban areas. The reference is to the year 2012. We see that in rural India, death rate at 7.6 is higher than national and urban death rates. And if we also look at the gender wise distribution of this, the death rate among males is higher at 8.3 and for females it was 6.8. The second table depicts the percent distribution of deaths by broad age groups in the reference year 2012 for India, and the age categories are 0 to 4, 5 to 14, 15 to 59 and 60 plus. We see that the highest death is noted in the age group of 60 plus years. Now, this figure, when it is broken down further into rural and urban areas across age groups and gender wise, is what we see in the following tables. Now, let us break down these India figures age wise, gender wise across rural and urban areas, and this is what we see in the following tables. In the first table, we see the death rates for children 0 to 4 years divided across rural and urban and gender wise. So, in the first table, we see that for rural areas, the death rate is higher among female. In the second table, which notes the death rates for children 5 to 14 years, we see in rural areas the death rate among males is higher, a little higher than that of females. Moving on, in the age group of 15 to 49 years, we see in rural areas the death rate in males is higher than that of females, and there is a considerable difference here, which is 4.6 for male and 2.8 for female. In the last table, we see the death rate for those above 60 years. Even here in rural areas, we see that the death rate is higher for male as compared to female. There is a considerable difference of nearly about 9 to 10. So, for male it stands at 50.7, whereas for female it stands at 41. So, what this effectively means is that for every 1000 males aged above 60 years in rural areas, there are 50 to 51 who die, and for every 1000 female above the age group of 60 years in rural areas, the death rate is 41. Infant mortality rate. Infant mortality refers to the death of an infant before his or her first birthday, that is within 1 year of his or her birth. An infant mortality rate is the number of infant deaths for every 1000 live births. 2018 data shows that the national infant mortality rate was 32. Madhya Pradesh had the worst infant mortality rate at 48 and Nagaland had the lowest at 4. In the last 10 years, infant mortality rate has witnessed a decline of about 35% in rural areas. Maternal mortality rate is defined as the number of maternal deaths per 1000 live births due to pregnancy or termination of pregnancy, and it shows the risk that is associated with pregnancy among women. Both infant mortality and maternal mortality rates are considered key health indicators, and they are largely preventable and treatable. Let us have a look at this table, which depicts infant mortality rate in India among rural and urban areas and distributed by gender. The reference here is 2012. We see that the infant mortality rate is higher in rural areas compared to total figures for India and also compared to urban areas. So, if we look at male-female breakup, even here rural areas, the figures are higher when compared to total India figures and to urban areas. The infant mortality rate we see in rural areas is higher among females than among males. So, it stands at 48 for females and at 45 for males. Even in the adjoining figure, we see that the infant mortality rate in rural areas is higher when compared to national and urban level figures. We see in the graph that the middle bar across each of the states depicted on the y-axis is higher than the bars for total and for urban figures. With regard to maternal mortality rate, despite several safe motherhood programs initiated by the government, the maternal mortality rate remains, especially in rural areas. Distance or lack of transportation and costs are challenges that are faced in accessing health facilities for delivery. There are other reasons like facility closures, poor service issues, etc. Delivery at a health institution is a key intervention in order to avoid the risk of maternal mortality due to childbirth related complications. Based on infant mortality and maternal mortality rates, the data, policies and programs can be strengthened to improve coverage of health facilities and also to improve institutional delivery. To conclude, what is the importance of having such demographic data? In the most basic, it helps us to gain an understanding of the different characteristics of a population. It is useful for making crucial policy decisions. It's essential for planning purposes. It helps us to plan for specifics, like what needs to be done, how much more has to be done, how many more has to be done. For example, the number of schools, the number of hospitals or healthcare facilities and centers, the number of jobs, which are the places and areas that need more attention, etc. Such data also provides the rationale for undertaking any development intervention, activity, program, project. It also helps identify the problem areas, identify the needs of the community and the populace, establish specific goals and objectives, assess if there is an alternative course of action, also allocate resources that are needed for implementation, and so on and so forth. To end the lesson, I leave you with an activity. Have a look at the table that is given here. It depicts mortality rate in the age group of 0 to 4 years divided by gender in rural areas. Understand the data that is given in this table, and based on your understanding, list down about 3 to 4 key interventions that you think can be planned to reduce mortality rate in this age group. Thank you.